my name's Dagmara Kutzing, and I'll be showing you two corrective exercise programs, week 1 and week 4. Week 1 will be a knees inward compensation that you typically find during a single leg squat assessment. And then week 4 will be knees outward compensation when somebody performs a jump squat during that assessment. So week 1 is going to be the knees inward compensation that typically is found during the single leg squat assessment. And I'll show you some of the self-myofascial release, the static stretches, the lengthening exercises, and the activating some activating exercises and some integrated dynamic movements for the knees inward compensation. So first off, we'll show you the self-myofascial release of the tensor fascia lata, and with that you just want to go onto your side and you want to hold in the tender area for about 30 seconds. And then you want to move on to your vastus lateralis, and that would also be done lying on it. And you would get your lateral side around here. So your thigh, your outer thigh, right here. And you would hold in that tender area, and that's getting the vastus lateralis as well. Then you would self-myofascial release the adductor magnus, so that would be around here, and that you can use your arm, and you would hold the tender area for about 30 seconds. You could also do it while lying on the ball, but I feel as if it's easier while holding it down on the tender area for 30 seconds. And then you would roll out, self-myofascial release the gastrocnemius right over here. Then you would roll, you would do some adductor stretches at the stair. So you would bring one leg and you would hold it like that for about 2 times 30 seconds. Some people do it this way. And you would hold it for 30 seconds like that. Then you would do the hip flexor stretch at the stair, and that would also be done with the feet facing forward each way. And you would switch to the other side as well. And then you would do the calf stretch at the stair. So you would go down with the heel, and hold it 2 times 30 seconds. And then you would do the adductor strap stretch. And you would wrap it around, and then you would hold it, and you would go to the side, and you would hold it 2 times 30 seconds, and you can go as low as you want with that one. Then you would want to do some exercises, and you would activation exercises, and one would be the squat with feet shoulder width apart. Then the side lying hip abduction, knee bent and leg up and down, and then you would straighten this leg out, have this leg forward, and you would raise the other leg 20 times as well. And then you would do the hip extension, so you would stand straight, and you would want to use your hips, not your back, but your hips to get the leg back and forward to the starting position, and then back again 20 times. Then the last of the knees inward compensation exercise, so you wouldn't have the knees inward, are the standing bicycles. So you would go touch the knee to the elbow each time 20 times. Then you would do the single leg bridge. You would have one leg bent and the other leg straight, and you would go up and down, up and down, up and down. Then you would do the single leg deadlift. So you would have a bar ideally in hand, but I'm using a ball, and you would want to go down and up, down and up, down and up. Then the last exercise would be the chop squats, and you would be basically in a squat position, and you would do one side first, and then you would do the other side. Then we're gonna go on to week 4 of a monthly program, but this one would be trying to fix a knees outward position, usually found during a jump squat. And the first self-myofascial release that we're gonna do are the hamstring. So the hamstring, we're gonna self-myofascial release, and we're gonna hold in the tender area for 30 seconds. And then we're gonna roll the ball upwards to self-myofascial release the piriformis. And then the gluteus medius. So a little bit there. And then again, the tensor fasciae lata, because that is also overactive during a knees outward compensation during a jump squat assessment. Then we would want to do a hamstring stretch at the stair, and you would want to raise the leg and just lean into it 2 times 30 seconds or 3 times 30 seconds. Then we would want to do the piriformis stretch, and that we would usually sit down or supine, and we are just gonna lean into it like that. And you'll feel all the muscles here. Okay, and then the next stretch that you would want to do would be a pigeon pose. So you would start off with a knee bent, then you would lower down, have the leg at your side now, and you would lower down into it, and you would hold 2 times for 30 seconds. And then the next stretch for the knees outward compensation would be a butterfly stretch, and that would get all the adductors and everything, all those muscles that we need to lengthen. Then we would want to do some of the activation exercises, and that's the quadruple leg kickback. And with that, you want to go upwards with the leg, you're on all fours and you're kicking back. And you would repeat on the other side. Then you would want to do the bridges, not single leg bridges this time, but just with both legs on the ground. And you would raise up 20 times. Then you want to do the squat with lateral leg raise. So you would squat down and then raise up the leg. Squat down, raise up the leg, squat down, raise up the leg, squat down, raise up the leg. Then we would want to do some leg pulses. And it's similar to the kickback, but you're sort of have the leg straight and you're pulsing it. Pulsating in small movements, and you will feel it after a little bit. You would have to do about 40 in order to feel the pulse, the movement, and everything. Then the last 4 exercises that you would want are integrated dynamic movements to help you out with the knees outward compensation. And that would be with V-ups with ball in between feet. And you would basically go up and down each time. Then the last 3 exercises are alternating jump lunges. And you would basically go into a lunge position and then you would alternate each time. And that would work the glutes. And then the next 2 exercises are the backwards lunge with arm raise. So each time you would do a backwards lunge, you would raise the arms up with ball or weight in hand. And then the last exercise that you would want to do are supine bicycles. And then you would want to raise up. You would alternate elbow to knee, opposite elbow, opposite knee. And you would want to do 20 of those. And that is all for the exercises. And that would help you out again with the first week would be helping you out with knees inward. That is typically seen during a single leg squat assessment. And then week 4 would be helping you out with knees outward during you typically seen during a jump squat assessment. Thank you.